Thank you very much, President. I move my motion 331, which is a motion relating to documents to do with the planning of a new hospital in Albury Wodonga. The Albury Wodonga Health is a cross-border service straddling the Murray River and serving the people of Wodonga, Albury and the surrounding districts of North East Victoria and Southern Riverina, New South Wales. It has an estimated population of more than 300,000 people. It is the only cross-border health service in this nation. It is a unique example of the interwoven nature of these communities where people cross the river for work, education, family and, most importantly, health services. Two states contribute to the costs, but the health campuses on both sides of the river sit under the management of the Victorian Government. It is also the biggest Victorian regional health service based on throughput and emergency presentations. The recently renegotiated intergovernmental agreement between the two states now extends until June 2035, about another 12 years or almost 3 terms of the Victorian Parliament. Demand on the service is through the roof. The hospital starts the day somewhere between 30 and 70 beds, short of what is needed for patients in intensive care, emergency and medical beds. Historical planning documents made it clear that neither the Albury nor the Wodonga hospitals were or are suitable for future health service delivery. The buildings and operating theatres are not fit for purpose. There are risks to patient safety. There is asbestos all the way through the Wodonga Hospital. Documents have also revealed the Albury Hospital is built on a highly reactive clay soil, prone to movement, and that one building has already moved 60 millimetres. So the decision of the Victorian and New South Wales governments to jointly spend $450 million on the Albury Hospital site to meet the current and future needs of these communities raised serious questions around how the two governments arrived at this point. When the two premiers came together in October 2022, the then Victorian Premier Dan Andrews claimed the new hospital would become a one-stop shop, an acute centre that would cut duplication and reduce the complications of spreading resources across two hospitals. This was the preferred outcome, a single-site hospital that could cater for current and future demand. For many who had been involved in the development of a 1,200-page master plan developed in 2021, almost a year prior, the surprise was that the investment was at the existing Albury Hospital. Most had expected it to be a greenfield site as recommended by the master plan, free from the pitfalls and challenges of turning an existing hospital into a construction zone for a decade. That mystery unravelled last year when some 2,000 pages of documents were obtained by the member for Benambra from the New South Wales Parliament. These highlighted some questionable behaviour in arriving at the decision to build on the Albury site. These documents suggest that New South Wales and senior management at Albury Wodonga Health had absolutely no intention of building the Border's much-needed new hospital on anything but the Albury campus. And all of that despite its well-documented limitations, its history of unstable ground and the greenfield build recommendation in the December 2021 master plan. What is also apparent from those documents was that no one was telling any of the stakeholders involved in the development of the master plan that the deal was done, that a brownfield build at Albury was locked in. Yet another document's motion in the New South Wales Legislative Council has revealed that the Albury Wodonga Health no longer believe it can consolidate its acute services on a single site with the funding that has been committed. That document was discovered last week, about the same time a new 130-page master plan with 700 pages of appendices selling the merits of a 10-storey tower at Albury was dumped on the community less than 24 hours before a community meeting that was trying to turn back the tide on the Albury plan. Despite all this paperwork, there is no certainty over the project, and New South Wales Health have admitted in budget estimates that they are still costing the final design and have not settled on a final costing. To fully understand the status of this project, the Albury Wodonga community need to be fully informed, and that is why I'm seeking these documents today. This is a simple motion that calls for the release of documents. It is a narrow motion that makes a request for a series of documents relating to a project. These documents that the Legislative Council has the right to request, and the Minister should release them. These are documents that the Legislative Council has the right to request, and the Minister should release them. I urge members to support this motion.
Ms Watt.
President, thank you very much for the call and opportunity to follow Ms Lovell in the contributions to the short form documents motion before us on the Albury Wodonga Health Clinical Services Plan and Master Plan, and also the work that we're doing with our friends a little bit north in New South Wales. And the truth is that no one quite knows health like the Allen Labor government, and we have absolutely revolutionised healthcare around Victoria, and this includes our regional areas, and as I said, our friends from the other side of the Great Murray have joined with us in our collaboration for a $550 million redevelopment of Albury Hospital, a combination that brings both governments brings together governments, communities and, of course, patient wellbeing. This project came to a significant point in the planning process in October 2023 after the master plan for the $588 million redevelopment was unveiled for major stakeholder and community feedback. And in that master plan, it really does set out an ambitious vision and clear framework for the development of the Albury Hospital campus, including some questions around the optimal location of the new clinical services building and the future expansion zones. Health services and all levels of stakeholders and our cross-border community there in Albury Wodonga have made their views known, of course, championed by the member for Northern Victoria, the Attorney General in this place. Can I also just say that the feedback time did seem quite significant to me. Opinions and feedbacks on this master plan opened from the 16th of October right through to the 24th of November through a series of consultations. That feedback from those consultations we are ensuring is meaningfully integrated as part of the project. In fact, as recently as last week, a project update with an overview of consultation activities and feedback from health staff, stakeholders and the local community was published by New South Wales. The Albury Wodonga Regional Hospital Project, or the 2023 Master Plan Report, has been published in response to the community's feedback, and we know that this Master Plan Report provides additional details on the preliminary studies and the technical inputs that have shaped the master plan, which I think is a pretty critical and important part of the master plan process. The information on the clinical services and project scope is indicative only at this early stage of planning, and I'll just reaffirm that. Can I also mention that this program is still one of the biggest modernisations of healthcare in the Albury Wodonga health community that we've ever seen, and the planning and design process, as comprehensive as it will ultimately be how the final project and planning scope is decided, and will further develop and evolve through the life of this project. We know what life is like for our cross-border communities, and we've got some very strong advocates for cross-border communities in this place, and currently patients must travel back and forth to receive the help they need. But the changes we're making, we're allowing patients to be treated in world-class medical facilities under one big sort of interstate roof, if you will. This combination of the facilities will see the residents of Albury Wodonga have increased access to a wide array of health services, and this is just another commitment to the community by the Allen Labor government. On top of course, our massive investment, we are also putting one of our priority primary care clinics in Wodonga as part of the 29 priority primary care clinics being rolled out right across the state. I'm really delighted actually to have an opportunity to talk about health and a focus particularly on regional health and the work of the Allen Labor government. And of course, I need to reaffirm that this is a substantial investment and we must get it right. That's $558 million. The track record speaks for itself. We're investing in our regions and we're doing more so than any other government. And I thank you very much.
Dr. Mansfield.
Thank you, President, and I'm pleased to rise in support of this motion. And at the outset, I'd also like to acknowledge the advocacy and work on this matter undertaken by my Greens colleague in New South Wales, Dr. Amanda Conn. The Albury Wodonga catchment area is approximately 300,000 people. That's bigger than our second city in Victoria, Greater Geelong. The border towns of Albury and Wodonga are no strangers to complexity when it comes to accessing government services like healthcare. And for years they've had to navigate an increasingly fragmented health service that straddles both towns. And what has evolved has really left them with significant safety issues. The most obvious example is that currently maternity and ICU services are on different sides of the Murray River. Not only is there an impractical and sometimes illogical split of services, the roles and responsibilities of the New South Wales and Victorian governments, from everything from clinical governance, data collection, EBAs, infrastructure investment, it's very complex and, from the community's perspective has often led to some confusion, challenges with getting transparent and timely information and responses. And this has contributed not only to reports about patient, or implications for patient safety, but there have also impacts on morale for staff trying to work across these two systems. So it's been known for a long time that a new hospital is required to address some of these concerns, and a 2021 master plan identified that a single site hospital for acute services was needed, and importantly it recommended a greenfield site. Instead, New South Wales and Victoria have decided on a different path, developing a brownfield site that we have, as Ms Lovell has outlined, recently learned it won't actually end up consolidating acute services onto one site, which was one of the drivers for undertaking this investment and this change in the first place. So millions and millions of dollars are going to be spent, and we are still going to have some of these issues with acute services being split across both sides of the border. The problems with this approach are many and have been well ventilated by communities in both Albury and Wodonga. Councils have made it really clear, the staff who work at these services have made it very clear, and many, many others in the community. It's worth noting that the communities in regional areas like Albury and Wodonga are heavily invested in their health services, much more so than in metro areas, because these are often a really core part of the community's identity. They not only provide services for the community, but they're often one of the major employers. So they are really important parts of the community. They understand the services and what they need, and yet it's really disappointing that, from what I've heard from so many people, is that the Victorian government has not adequately engaged with these communities. They have not listened to what they know and understand about what their communities need and how to improve the health services. And when challenged about their plans, the government has doubled down and said, no, this is what we're doing and it's terrific. Worse, I think, has been the failure to be open and transparent about the basis for the decision to go ahead with a brownfield site as opposed to the greenfield site recommendation from that 2021 master plan. The community has been asking why. Why have you gone down this path? Where's the business case? Where is, what is the rationale for this? Provide us with some evidence, and been met with silence. So that lack of transparency, I think, has been almost as bad as the decision that seems to go against what the community has been asking for. So, we think, if the government has a great rationale for this, fine, but be transparent with the community, give them the information, explain why. So therefore, we are very supportive of this DOCS motion. Transparency is the very least that the communities of Albury and Wodonga deserve.
I don't believe there's any more speakers on this item, so I'll put the question that Ms Lovell's notice of motion 331 be agreed to, or let it be say aye. Aye. Against no. I believe the ayes have it. I'll now call